Are you ready to master the respiratory system for the NCLEX? This video delivers 20 high-yield questions, each with clear, powerful rationales and expert strategies to help you think like the NCLEX. Whether you're reviewing before the big day or strengthening your weak spots, you're in the right place. Stay locked in, because what you learn here might be the key to passing your NCLEX on the first try. Question 1. A client with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy at 4 liters per minute via nasal cannula. The nurse monitors the client closely for which complication: A. Hypercapnia, B. Hypovolemia, C. Hypokalemia, D. Hyperglycemia. Correct answer: A. Hypercapnia. Rationale: in clients with advanced COPD, especially those who are chronic CO2 retainers, their respiratory drive becomes dependent on hypoxia rather than hypercapnia. This means that administering high-flow oxygen can blunt their drive to breathe, leading to hypoventilation and worsening hypercapnia, which may precipitate respiratory acidosis and even coma. Oxygen should be titrated cautiously, and the patient should be monitored for signs of CO2 retention. The other options, hypovolemia, hypokalemia, and hyperglycemia, are not typical complications of oxygen therapy in COPD patients. Test-taking strategy. When managing COPD patients on oxygen, recall that less is more. Use the lowest oxygen concentration necessary to maintain adequate oxygenation, usually SpO2 of 88 to 92%. If you see high-flow oxygen in a COPD question, assess if the client may be at risk of respiratory depression or CO2 narcosis. Question 2. The nurse is assessing a patient who has just undergone thoracentesis. Which findings should be reported to the healthcare provider immediately? A. Respiratory rate of 22 breaths per minute. B. Oxygen saturation of 95%. C. Sudden onset of shortness of breath. D. Mild chest discomfort at the puncture site. Correct answer: C. Sudden onset of shortness of breath. Rationale: thoracentesis involves inserting a needle into the pleural space to remove fluid. A potentially serious complication is pneumothorax, which can occur if the lung is accidentally punctured. Sudden shortness of breath is a hallmark sign of this condition. The other findings, mild tachypnea, adequate oxygenation, and discomfort, can be normal post-procedure. Immediate action is required if the patient exhibits new respiratory distress. Test-taking strategy. Always look out for signs of deterioration after invasive procedures, especially those involving the lungs. A sudden change in breathing or chest pain is a red flag. When answering NCLEX questions on procedures like thoracentesis, prioritize life-threatening complications. Question 3. A patient with pneumonia is receiving IV antibiotics and oxygen therapy. Which assessment finding indicates the treatment is effective? A. Respiratory rate increases from 18 to 24 breaths per minute. Bilateral lung sounds become more coarse bilaterally. C. Temperature increases to 39.5 degrees Celsius, 103.1 degrees Fahrenheit. D. Oxygen saturation improves from 88% to 95%. Correct answer: D. Oxygen saturation improves from 88% to 95%. Rationale: improved oxygen saturation demonstrates better gas exchange, indicating that the inflammation and fluid associated with pneumonia are resolving. An increased respiratory rate and fever suggest the infection may be worsening or not responding to treatment. Coarse lung sounds might indicate retained secretions or progression of disease. Therefore, the most objective and positive clinical improvement is seen in oxygenation. Test-taking strategy. When evaluating treatment outcomes, focus on measurable positive physiological changes. High oxygen saturation is a reliable indicator of respiratory improvement. Eliminate distractors that show worsening trends or vague clinical signs. Question 4. The nurse is teaching a client with asthma how to properly use a metered dose inhaler, MDI. Which instruction should the nurse include? A. Inhale quickly while pressing down the canister. B. Shake the inhaler and exhale completely before use. C. Hold your breath for 3 seconds after inhalation. D. Avoid using a spacer with this device. Correct answer. B. Shake the inhaler and exhale completely before use. Rationale: proper use of an MDI includes shaking the canister to mix the medication and exhaling fully to empty the lungs before inhaling the medication. The client should then inhale slowly and deeply while pressing the canister and hold their breath for about 10 seconds, not just 3 seconds, to allow the medication to deposit in the lungs. Spacers are recommended to enhance drug delivery and reduce oropharyngeal deposition. Test-taking strategy: know the step-by-step protocol for inhaler use, which is frequently tested on the NCLEX. Eliminate choices that reflect improper timing or technique. Keywords like quick inhale or no spacer are red flags in asthma education questions. Question 5. Which intervention is a priority for a client experiencing a severe asthma attack? A. Administering an oral corticosteroid. B. Encouraging deep breathing and coughing. C. Giving a short-acting beta agonist via nebulizer. D. Applying a warm compress to the chest. Correct answer. C. Giving a short-acting beta agonist via nebulizer. Rationale: during a severe asthma attack, the airways are constricted and inflamed, making it critical to relieve bronchospasm quickly. Short-acting beta agonists like albuterol provide rapid bronchodilation and are the first-line treatment. Oral corticosteroids take longer to act and are more useful in long-term control. Warm compresses and deep breathing may be supportive, but they are not priority interventions during an acute episode. Test-taking strategy: in emergencies, always prioritize interventions that provide immediate relief. Know your rescue drugs for asthma, like albuterol, and remember that delivery via nebulizer is preferred in severe attacks due to better lung deposition. Question 6. A nurse is caring for a patient with active tuberculosis, TB. Which infection control precaution is appropriate? A. Contact precautions using gloves and gown. B. Droplet precautions using a surgical mask. C. Airborne precautions using an N95 respirator. D. Standard precautions only. Correct answer. C. Airborne precautions using an N95 respirator. Rationale: TB is transmitted via airborne particles that remain suspended in the air. Therefore, airborne precautions are required, including a negative pressure room and the use of an N95 respirator by healthcare personnel. Contact or droplet precautions are insufficient to prevent the spread of Mycobacterium tuberculosis. Test-taking strategy: memorize which conditions require airborne, droplet, and contact precautions. TB, measles, and varicella are airborne. If you see TB, immediately think N95 and negative pressure room. Question 7. Which finding is most concerning in a patient with a chest tube for pneumothorax? A. Gentle bubbling in the suction control chamber. B. Drainage of 80 milliliters of serosanguinous fluid over 4 hours. C. Continuous bubbling in the water seal chamber. D. Tidling with respirations in the water seal chamber. Correct answer. C. Continuous bubbling in the water seal chamber. Rationale: continuous bubbling in the water seal chamber indicates an air leak in the system, which may prevent the lung from fully re-expanding. Tidling, fluid level rising and falling with respiration, is a normal finding. Gentle bubbling in the suction chamber shows that suction is working. Moderate drainage is also within normal limits. Test-taking strategy: differentiate normal from abnormal chest tube findings. Continuous bubbling equals air leak equals danger. Focus on where the bubbling occurs, as each chamber has different normal expectations. Question 8. A client who recently had a total laryngectomy is receiving tube feedings. What nursing intervention is most important? A. Encouraging the client to drink water during feeding. B. Positioning the client flat to reduce neck tension. C. Monitoring for signs of aspiration and coughing. D. Suctioning the airway every 30 minutes regardless of need. Correct answer. C. Monitoring for signs of aspiration and coughing. Rationale: even after a laryngectomy, aspiration is still possible via esophageal reflux or improperly managed enteral feedings. Ensuring head elevation and monitoring for signs like coughing, increased secretions, or desaturation is essential. The client should not drink fluids unless cleared. Suctioning should be performed only as needed to avoid mucosal damage. Test-taking strategy. In surgical airway patients, airway monitoring remains a priority. Watch for signs of aspiration, especially with tube feeding. Eliminate distractors that involve unnecessary or contraindicated interventions. Question 9. Which symptom is an early sign of hypoxia? A. Cyanosis. B. Bradycardia. C. Restlessness. D. Hypotension. Correct answer: C. Restlessness. Rationale: the earliest signs of hypoxia involve changes in behavior and mental status due to reduced oxygen delivery to the brain. Restlessness, anxiety, and irritability are early neurological indicators. Cyanosis, hypotension, and bradycardia are late signs of severe hypoxia. Test-taking strategy: use the acronym RAT, restlessness, anxiety, tachycardia, for early signs of hypoxia. Recognize trends and stages of clinical deterioration. Early identification allows for early intervention. Question 10. A client with emphysema reports increased shortness of breath. What is the nurse's first action? A. Notify the healthcare provider. B. Increase the oxygen flow rate. C. Encourage pursed lip breathing. D. Place the client in supine position. Correct answer: C. Encourage pursed lip breathing. Rationale: pursed lip breathing helps prevent airway collapse and promotes more effective exhalation, particularly in clients with emphysema who have air trapping. It improves oxygenation and reduces dyspnea. Increasing oxygen can be risky in COPD. Supine position impairs lung expansion. Notification of the provider should occur after immediate helpful interventions. Test-taking strategy: when facing a dyspneic COPD patient, think non-pharmacologic breathing techniques first. Pursed lip breathing is a tested, effective, and safe intervention to relieve symptoms quickly. Perfect. I'll continue with the same detailed format for the next batch. Questions 11 to 20 on the respiratory system. Question 11. Which instruction should the nurse include when teaching a client how to perform incentive spirometry after abdominal surgery? A. Inhale forcefully through the nose to raise the ball. B. Exhale deeply into the device for as long as possible. C. Inhale slowly and deeply through the mouthpiece. D. Use the device every 4 to 6 hours while awake. Correct answer: C. Inhale slowly and deeply through the mouthpiece. Rationale: the purpose of incentive spirometry is to promote lung expansion and prevent post-operative complications such as atelectasis and pneumonia. The correct technique involves placing the mouthpiece between the lips and inhaling slowly and deeply to raise the indicator, followed by holding the breath for 3 to 5 seconds. Exhaling into the device is incorrect. The client should use the device every 1 to 2 hours while awake, not just every 4 to 6 hours. Test-taking strategy: pay attention to action verbs in the choices: inhale versus exhale, slow versus forceful. Eliminate any choices that contradict the purpose of lung expansion. Knowing proper post-operative respiratory techniques is essential for NCLEX. Question 12. The nurse is caring for a client with acute respiratory distress syndrome, ARDS. Which finding is most concerning? A. PaO2 of 85 millimeters of mercury on room air. Bilateral crackles on auscultation. C. Restlessness and confusion. D. Respiratory rate of 22 breaths per minute. Correct answer: C. Restlessness and confusion. Rationale: restlessness and confusion are early neurological signs of hypoxia. In ARDS, oxygenation is severely impaired due to alveolar capillary damage, leading to hypoxemia despite oxygen therapy. This neurological change suggests worsening oxygen delivery to the brain. Partial pressure of oxygen of 85 is normal. Crackles and slightly elevated RR may be expected, but are less urgent. Test-taking strategy: in acute conditions like ARDS, changes in mental status often precede other vital sign changes. Always prioritize assessment findings that reflect early deterioration in oxygenation. Think, brain first. Question 13. A client with a history of asthma reports using their albuterol inhaler several times per day. What should the nurse assess next? A. Frequency of rescue inhaler use. Basic technique for using a peak flow meter. C. Dietary intake of caffeine. D. Time of day symptoms occur. Correct answer. A. Frequency of rescue inhaler use. Rationale. Frequent use of a short-acting beta agonist, like albuterol, suggests poor asthma control, which may require medication adjustment or the addition of a long-term controller. Albuterol should be used no more than twice per week outside of exercise-induced symptoms. While other factors, like peak flow technique and symptom timing, are relevant, assessing frequency of rescue inhaler use is the priority. Test-taking strategy. For chronic conditions, NCLEX focuses on evaluating control versus exacerbation. Overuse of rescue meds always signals poor control. Prioritize identifying red flags that call for treatment modification. Question 14. The nurse is reviewing ABG results for a client. pH 7.32, PaCO2 50 mm of mercury, HCO3, 24 milliequivalents per liter. How should the nurse interpret this? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Correct answer. C. Respiratory acidosis. Rationale. A pH below 7.35 indicates acidosis. PaCO2 above 45 millimeters of mercury indicates CO2 retention, confirming a respiratory cause. Since HCO3- is normal, this is uncompensated respiratory acidosis. This typically results from hypoventilation, such as in COPD or sedation. Test-taking strategy. Use the Rome method. Respiratory opposite, metabolic equal. Match the pH direction with either CO2 or HCO3-. Practice reading ABGs systematically to answer these quickly and accurately. Question 15. Which finding in a client receiving mechanical ventilation requires immediate intervention? A. Respiratory rate set at 16 breaths per minute. B. High-pressure ventilator alarm sounding. C. Presence of oral secretions. D. Tidal volume of 500 milliliters. Correct answer. B. High-pressure ventilator alarm sounding. Rationale. A high-pressure alarm indicates an obstruction in the ventilator circuit or airway, such as kinked tubing, secretions, biting the tube, or bronchospasm. This can lead to inadequate ventilation and hypoxia if not promptly addressed. The other findings are expected and stable. Test-taking strategy. On NCLEX, ventilator alarms are high yield. Memorize. High pressure equals obstruction. Low pressure equals disconnection or leak. Always address alarms first. Don't silence them without investigating. Question 16. The nurse is caring for a client with pulmonary embolism, PE. Which symptom is most indicative of this condition? A. Bradycardia and pale skin. B. Gradual onset of dyspnea over a few days. C. Sudden shortness of breath and chest pain. D. Productive cough with yellow sputum. Correct answer. C. Sudden shortness of breath and chest pain. Rationale. PE typically presents with sudden onset of dyspnea, pleuritic chest pain, tachypnea, and possibly hemoptysis. It results from obstruction of a pulmonary artery by a thrombus. Gradual dyspnea is more typical of chronic diseases. Productive cough suggests infection. Bradycardia and pallor are not classic signs of PE. Test-taking strategy. Associate sudden dyspnea and pleuritic pain with PE. Eliminate distractors that are gradual, nonspecific, or infection-related. When you see sudden plus respiratory, always rule out PE first. Question 17. A client with COPD is prescribed Theophylline. What is the nurse's priority in monitoring? A. Fluid intake. B. Blood glucose level. C. Theophylline blood levels. D. White blood cell count. Correct answer. C. Theophylline blood levels. Rationale. Theophylline has a narrow therapeutic range, 10 to 20 micrograms per milliliter. Levels above this can cause severe toxicity, including seizures, arrhythmias, and hypotension. Monitoring the drug level is critical to ensure safe dosing. The drug's effects are not closely tied to glucose or WBCs. Fluid intake is important, but not the priority. Test-taking strategy. No drugs with narrow therapeutic windows, like theophylline, lithium, digoxin. These always require serum monitoring and are common NCLEX topics. Question 18. What position is best for a conscious client experiencing dyspnea? A. High Fowler's position. B. Supine with legs elevated. C. Trendelenburg position. D. Side lying with knees bent. Correct answer: A. High Fowler's position. Rationale: High Fowler's allows for maximum lung expansion, facilitating diaphragmatic movement and reducing work of breathing. Supine or Trendelenburg impairs ventilation. Side lying is used in unconscious patients to protect the airway, not to relieve dyspnea. Test-taking strategy: always associate upright positioning with respiratory distress. When in doubt for breathing issues, sit the patient up. Question 19. A nurse auscultates wheezing in a client with asthma. What causes this sound? A. Air moving through fluid-filled alveoli. B. Air passing through narrowed airways. C. Mucus obstructing large bronchi. D. Lung parenchyma stiffening. Correct answer: B. Air passing through narrowed airways. Rationale: wheezing is a high-pitched musical sound caused by air moving through narrowed or inflamed airways, commonly seen in asthma and bronchospasm. Crackles are due to fluid. Raunchy, low-pitched, result from mucus. Stiff lung parenchyma causes reduced breath sounds, not wheezing. Test-taking strategy: match lung sounds with their mechanisms. Wheezing equals asthma equals bronchoconstriction. Eliminate options that describe different adventitious sounds. Question 20. Which instruction should be included in discharge teaching for a client with sleep apnea using CPAP therapy? A. Use the CPAP device only when experiencing symptoms. B. Clean the mask and tubing weekly with mild detergent. C. Use the CPAP device every night during sleep. D. Limit fluid intake 2 hours before using the machine. Correct answer: C. Use the CPAP device every night during sleep. Rationale: consistency is essential in obstructive sleep apnea management. CPAP maintains airway patency by delivering continuous pressure. The client should use the machine every night, even if they feel fine. The equipment should be cleaned daily. Limiting fluids is not specific to CPAP use. Test-taking strategy: look for patient education that reinforces compliance and routine use. Eliminate any answer that suggests partial or occasional usage of a prescribed device. You did it! You just tackled 20 high-yield NCLEX respiratory questions, backed with solid rationales and smart strategies. Remember, repetition builds confidence, and confidence crushes test day anxiety. If this helped you, don't forget to like, subscribe, and drop a comment letting us know what you want to master next. You've got what it takes. Keep pushing forward. Your RN license is closer than ever. See you in the next one.